looking for some cancer screening, gallery testing is great because it tests for 50 different types of cancers. MyFit Foods, they are great partners with us, especially for our weight loss patients and our hormone patients too. And we have Sumit's Yoga here in Colorado. So if you like hot yoga like me, they're the place to go to. A little bit about me. I'm Manpreet. I am a board-certified nurse practitioner. My educational background, I have my undergrad in nursing from University of North Carolina in Greensboro, and my graduate degree is in nursing education. So that's why I'll be asking you a lot of questions today, giving you a pop quiz at the beginning and at the end. And then I have my postgraduate degree as an adult gerontology primary care nurse practitioner. Professionally, I've kind of have a wide variety of experience: cardiac, geriatric nursing, medical surgical nursing. I've also worked in infectious disease, especially during that COVID era, men's health and wellness hormone optimization. And I'm also a nursing professor at Maryville University in St. Louis. As far as my hormone education goes, I have trained through WorldLink Medical, Avexius Health Solutions, the American Academy of Anti-Aging, A4M, and currently I'm pursuing my certification in through the Menopause Society. Here's some really good reads. These are some books or some resources that I routinely recommend to my patients. So, you know, we all can go on social media, right? There's all sorts of information out there. So these are some really good sources that you can use for just self-education. Pretty easy reads. The first one is Normal Isn't Optimal. How many of you have been told by your physicians, primary care providers, or other general practitioners that your labs are normal? Right? No matter how you feel. It's normal. So, for example, say that we have a male and their testosterone levels are at 350. They fall in that normal range, but maybe they don't feel normal. They're having symptoms. So this is all about optimizing your hormones, not just being normal. So this is a really good book by Dr. Neil Rouzier, Normal Isn't Optimal. And the other one that I really like is by Dr. Morgan Toller, Testosterone for Life. And then The Hormone Havoc. I think we have some copies maybe out there too from Avexius Health Solutions for you guys to pick up. The penis book. I was hoping that I would get some giggles on that one. So this is a really good book that I recommend to my male patients that are suffering from erectile dysfunction. Estrogen Matters is a great book for females, but it's also a good book for males as well, because estrogen is important, not just in females. It's also very important in males as well. And then I have a website for Dr. Rebecca Glazier, who did a lot of work with breast cancer patients and doing some pellets with testosterone post breast cancer. So check that website out for her, from her too. And she has all of her research articles published on that website. So what we'll be talking about today is what you need to know about hormones, just laying the foundation, and then common misconceptions, and then what your options are to optimize your hormones. All right, true or false? So here's my questions. HRT turns you into the Hulk or the Wonder Woman? What do you think? I hear this all the time. I really do. Is it going to make me Hulk Hogan if I take testosterone? Is it going to make me grow a beard as a female? So you can see that HRT will make you grow a beard, ladies, or cry at rom-coms, gentlemen. What do you guys think? Will it do that? I get guys coming in all the time. It's like, you know, I was watching a Hallmark movie, or my wife was watching a Hallmark movie, and I was crying. I cry at kitty cats when I see them. No, HRT is not going to make you that way. Once you start HRT, you're stuck forever like an awkward Netflix subscription. True or false? What do you think? Definitely false. So I tell my patients all the time, okay, try it out. If things don't get better, don't do it. If you're taking blood pressure medication, your blood pressure is not getting better with that particular medication, why take it? Maybe there's something else that's going on that needs to be checked out. So you're not really married to it, but do some people require HRT for lifetime? Yes, absolutely, to keep their symptoms under control. HRT is like Botox for your hormones. It's just vanity. What do you think? True or false? False, right? False for sure. You're absolutely correct. It's going to make you feel different. So it's not just what you look like on the outside, but also how you feel on the inside. All right, here you go. I just had those explanations. Nope, hormone therapy isn't going to have you ripping your shirts, right, with bulging muscles. Hormones aren't here to mess with your personality or turn you into someone else entirely. I have a colleague that sometimes male patients will come in and say, you know, my wife said that I've changed a little bit. I'm more angry. And she said, you know what? If you were a jerk before testosterone, you're going to be a jerk after testosterone. It's not going to make you a jerk. So unlike that random streaming service you forgot to cancel, HRT is flexible for sure. HRT isn't vanity. It is going to make you feel like a human again. So I want you guys to just take a minute and ask yourself, do I want to live or do I want to just be alive? What does that mean to you? Anybody? What does that mean to you? What do you think?
Well, I think some people exist like we're not living to the full optimum. And I've been in hormone therapy for a long time, and it's made a big difference to me in staying young and active and enjoying every day.
That's right.
And not aging as quickly as we do.
Yep. Feeling alive, right? Absolutely correct. And even think about, say that somebody is bedridden, they're in a nursing home. My mom, for example, is on hospice right now. What do you think she would say, right? Do I want to be just alive or do I want to live? Do I want to live my optimal life? So that's what hormones can do for you. Many people today are kept alive with medications and workarounds, but still don't feel well, energized, or fully present, like you were saying, right? It's kind of keeping that livelihood for you. So menopause. Today, over 75 million women in the United States are experiencing perimenopause, menopause, or postmenopausal symptoms. Andropause is kind of like the male menopause. So this affects about 1 in 4 men over 40, roughly 30 million men in the US. Low testosterone doesn't just affect energy, it affects your mood, it affects your motivation, it affects your sleep, weight, and sexual health. So when women are transitioning and males are transitioning as they age into those menopausal years, hormone levels tend to shift, and that can lead to a variety of different types of symptoms. So why do a lot of patients don't get any answers? What do you guys think? Why do patients don't get answers?
Because it's not Western medicine.
That's right. Yeah, mainstream medicine, right? Western medicine. Many healthcare providers usually receive very limited education on these types of topics. So we really have to go outside of our regular education to get more information, get more education related to hormones so we can actually put that into practice. There's a lot of misunderstandings too, a lot of fear, right, surrounding hormones that can actually prevent proper evaluation and treatment. As a result, many patients are left coping with symptoms that could actually be just improved in a very simple manner. So my goal here today is to just empower you all with knowledge, because I know as an educator that education helps to reduce confusion, it helps to reduce anxiety about hormones as well, and understanding your symptoms can help individuals seek that proper support too. For example, Liz, right? I was just at a neighborhood and I went to a little menopause talk, and Liz was like, yeah, sign me up. I'm going to come and see you because I don't know anything about this. So hormone health is really a key part of healthy aging and longevity. What are hormones? Hormones are the chemical messengers that give our cells and organs the proper instruction to keep us healthy. The Greek meaning of hormones is setting in motion to excite, to stimulate. So think about the last time you felt that way, where you felt motivated to get out of bed in the morning and do something exciting, do something new, take on a new project. When was the last time you felt like that? Maybe some of you do, maybe some of you don't, right? So I set in motion, I urge, and I excite. There are over 50 endocrine hormones, but today we're only going to be talking about estrogen. We're going to be talking about testosterone, progesterone, and thyroid. So when hormone levels naturally decline with age, it can trigger this widespread change all over the body that can give a lot of different types of symptoms that we can't cope with. And it also affects your overall health and longevity. There's a lot of talk about longevity these days, right? Hot, cold plunges, saunas, all these different types of things, peptides. But guess what? Those things don't work really well if you don't have the foundation. And your hormones are really the foundation of longevity. Take a minute here again. Have any of you experienced any of these symptoms? Extreme fatigue. 3 or 4 o'clock, hitting a wall. I don't want to do anything after I get home from work. I just want to lay on a couch, watch TV. I don't want to play with my kids because I don't have the energy to play with my kids. Anxiety, depression, mood swings, irritability, lack of sleep. A lot of times my patients tell me that they can fall asleep okay, but it's really hard for them to stay asleep. They wake up around that 3 or 4 o'clock in the morning and then can't go back to sleep. Lack of focus, can't get my projects completed because I don't have a focus. I'm here all over the place. Night sweats, hot flashes, weight gain. That's a very common complaint as well. And also redistribution of the fat around the belly area. Joint pain, severe migraines, low libido is another common complaint. Memory loss, brain fog, and bloating. Especially in females, the bloating is a pretty common complaint. Here's some menopause and andropause symptoms. There's some symptoms that we share as males and females. You can see mood swings, depression, headaches, night sweats, insomnia, weight gain, and bone loss can happen in both males and females. The top 3 things that my male patients tell me that they come in with as far as their complaints is low energy, low libido, and lack of motivation. Female patients, usually in that menopausal, perimenopausal years, hot flashes, forgetfulness, and they talk about vaginal dryness as well, especially as they're going into those menopausal years. These are just definitions. So perimenopause, that's where females will start to experience these varied menstrual cycles. They get really heavy periods, or they get really light periods, or they'll miss periods for a long period of time and then get a really heavy period again. And this is where they'll start to experience frequent mood changes, where they kind of feel crazy. Usually we don't tell ourselves that we're crazy, but our loved ones will, for sure, right? Hormone decline starts to happen. And then in the menopause years, the average age usually for menopause is around 53 and 54. It's different for everybody, but that's the average age. That's where a female has gone at least 12 consecutive months without a period. We do have to check other hormones as well, FSH, LH, and all estrogen and progesterone to see where they are. But if you have a period at 11 and a half months, you're not in full menopause yet, okay? If you have a period at 11 months, you're not in full menopause. So it has to be consecutive 12 months to be considered menopause. And postmenopause begins after menopause. This is where hormones continue to stay low in females, and that's where the long-term effects going to start to appear. So cardiovascular disease, bone health starts to decline here too. Memory can start to decline here as well in postmenopausal years. Estrogen. Estrogen is a really vital hormone for both males and females. Estrogen has about 400 plus functions in the body. It's really good for your cholesterol. It's really good for energy and vitality and stamina and motivation. For females, it maintains that vaginal blood flow and lubrication for sexual intercourse. And it's also responsible in both in men and females for the intensity of orgasms. Estrogen protects against heart disease, osteoporosis, colorectal cancer in females, UTIs, and urinary incontinence. So if I have a female that comes in and complains of vaginal dryness, also tells me that she has frequent UTIs, this will probably be the first hormone that I would prescribe for her to really build up that vaginal health again. It also protects against Alzheimer's disease and memory disorders. Estradiol is also important for males. So for bone health, it's important for brain function, libido and sexual function, cardiovascular health, and body fat regulation. So how many of you seen guys that are, Josh here does not look like that, but you've got, how many of you seen like really buff guys up here, a lot of muscles, but they have this like big belly? Right? She was just, signaling that. You guys seen that, right? So it's usually in guys who are taking testosterone, but they're blocking their estradiol, their estrogen, with an AI. You don't want to do that because that redistributes the fat component in the body to that belly area. So estrogen is really, really important for males as well as females. And also those guys that have the big belly but really big muscles over here, their libido and their sexual health is probably down the tank, okay? 100%. So any guy who is taking testosterone should not be taking an AI aromatase inhibitor to block their estradiol levels. It's very detrimental, especially for your heart health too. The other thing to keep in mind is that in men, estrogen and testosterone really needs to be balanced to control that sex drive, to control that sperm production, and the ability to have an erection, and also gynecomastia. Gynecomastia is basically man boobs. One of the reasons that really attracted me to LaVie was the fact that here at LaVie, we could really do like a continuum of care for a patient. So for example, if I have a patient that comes in with gynecomastia, we have world-class surgeons here that could do their surgery. But I know, and they know, that surgery is going to take care of the genetic component where they can remove that tissue, but they also are going to need a hormonal balance here. So now we can treat them with surgery and we can also balance their hormones. So that's one thing that I really love about LaVie is that we have a great OR, and then we have hormone replacement here. We've got facials, we got all sorts of things. Hot flashes ahead. Okay, ladies, watch out. When we hit our menopausal years, this is definitely going to happen. Not just for the ladies, but I also put this up for the guys too, because they're going to suffer right along with us, right? Because we're going to have those hot flashes coming. So menopause is not really just about hot flashes. It's also something that leads to osteoporosis. From the onset of menopause to age 60, women lose on average about 25% of their bone mass because the estrogen and the testosterone starts to decline. So think about that. We live in Colorado. It snows a lot, right? I don't want to be walking down the street, fall and break my hip. Nobody wants to do that. So 80% of osteoporosis patients are women. Menopause is a sex-specific risk factor for decreased bone density and fractures. So why would females not want to replace their estrogen, right, early on? During menopausal years, there's also risk for cardiovascular disease. 5 times more women die from heart disease than breast cancer. Cardiovascular disease is leading cause of death for women in the US. Studies have shown that women who start HRT early in menopause experience about 30 to 50% reduction in their cardiovascular disease. So why would we not start estrogen, estradiol early on in those menopausal years? Here's some additional symptoms that females can experience: anxiety, mood swings, vaginal infections actually, hair thinning, bloating, depression, and memory loss. as their estrogen or estradiol levels start to go down in those menopausal years. If I tell my female patient all of these different things, they're like, I'm not so sure. If I say, you know what, estradiol is so good for your skin, sign me up. I'm ready. I'll do it. I'll bathe in it if I need to, right? So estrogen is really, really important for all of those things. Let's talk about some facts about testosterone. So believe it or not, testosterone actually is the most abundant hormone in females. So both males and females need testosterone. Studies suggest that women lose about 1 to 2% of their testosterone production per year starting in their mid-20s. The other thing that affects females and their testosterone levels is taking oral birth control pills. That will drop that female's testosterone levels to 0. So now think about it. The female may be taking that testosterone to not get pregnant. Well, guess what? Her libido is 0. Does she want to have sex? Probably not, right? So oral birth control pills can drop down your testosterone levels to a very low level. So that affects female libido as well and sexual health. By menopause, their testosterone levels may drop by 50% or more compared to their peak levels in early adulthood. Remember 3 B's, okay? Everybody remember 3 B's, especially related to females and testosterone. Brain, bone, and breast protective. Earlier, I mentioned Dr. Rebecca Glazier. She did a lot of work on with patients who had breast cancer and doing testosterone pellets and seeing that tumor actually shrink. So I encourage you to go to her website and take a look at her research there as well. Men aged 30 to 70 will lose about 1 to 10% of testosterone per year. Testosterone is prostate protective. Prostate protective. Provides major symptom relief for both men and women. Here's some low T symptoms, additional symptoms that happen in females and the risk of disease. Decreased libido, we already talked about. Fatigue, thinning hair because testosterone levels start to go down. Weight gain and anxiety. So when females start to gain that weight, they're at a higher risk for developing diabetes, insulin resistance, heart attack, cardiovascular disease, and different types of cancers. And then on the other hand, my male patients, as I mentioned earlier, top 3 symptoms they tell me about is that they have decreased libido, and there may be some mild to moderate erectile dysfunction associated with that. They tell me that they have low energy, and that they tell me that they have lack of motivation. I don't want to do anything anymore. I come home and I just want to go to sleep. I don't want to be with my partner anymore. I don't want to play with my children anymore. That lack of motivation is really, really stressful for those patients. Loss of muscle mass, redistribution of fat, especially into that midsection. So patients who have underlying diabetes, hypertension, and sleep apnea are more likely to have lower levels of testosterone. So those patients really need to be screened to make sure that we go ahead and start supplementing them. Progesterone. So this is the one hormone that we do not give to males because it's actually not good for males. But for females, this hormone is just magical. Okay, it's really, really good for females. Progesterone is produced in the ovaries, and when in menopause, your levels could be close to 0. Progesterone moderates many effects of excess estrogen. It reduces fluid retention, bloating, headaches, bleeding, and fibroids. So females in those perimenopausal years, if they're just seeping through their tampon, they're seeping through their pad, they're afraid to go out because they think they're going to leak around, progesterone does wonders for them. Progesterone is synergistic to estrogen's effect on bone health and also on lipids. So they work hand in hand. So if you're taking estrogen or estradiol, you have to take progesterone with it, even if you are missing your uterus, because progesterone has a lot of other good things that it does for you. For example, sleep. So if you have trouble sleeping at nighttime, the number one thing I would do for you is put you on some micronized oral progesterone at bedtime, because you will sleep like a baby with that. Okay, it's really, really good for your sleep. It increases metabolism and promotes weight loss, helps alleviate depression and anxiety. So I even have female patients that I will put on progesterone during the day if they get some like more panic attacks, or maybe they feel anxiety during the daytime. They can actually take a troche right under the tongue, a dissolvable, to help with that anxiety. But you don't want to take that micronized pill or the oral capsule during the day because it makes you sleepy. So you definitely want to take that at nighttime. But there's some other modalities that you can do for that anxiety symptoms that may come on. Enhances action of our thyroid hormone too. A lot of us suffer from low thyroid production. Stimulates production of new bone, helps balance blood sugar levels as well. So this is a really, really good hormone for females. Let's talk about thyroid. So we talked about testosterone, progesterone. What else did we talk about? Estrogen. That's exactly right. And then thyroid is really the icing on the cake. So once we've optimized all the other hormones, and say that the patient comes back and say, you know, I still don't feel so well. I still have a little lack of energy. So it's usually related to their thyroid hormone. This may be the first hormone that I add on, or this may be the last hormone that I add on. Your thyroid hormone regulates your metabolism. It controls how fast your cells convert nutrients into energy. So this hormone is really key for those patients that are wanting to lose weight, right? You're on a GLP-1, trying to lose weight, and that starts to control your appetite. But sometimes that low functioning thyroid will not get you to where your goal is for that weight loss. So it's really important to make sure that you have your thyroid checked. So those of you who've been to your primary care provider, I'm sure you've gotten your labs done, your yearly labs. Does anybody know what lab value your primary care provider might check for you when they check your thyroid? Anybody remember? They check your antibodies, good, to see if your immune system is producing antibodies or attacking your thyroid, right? Okay. Anybody else seen their thyroid labs at all? What do they check? Usually it's one lab. If they check their thyroid antibodies, I'm super impressed. Usually it's the TSH, thyroid stimulating hormone, right? You probably know, you're a lab person, right? Thyroid stimulating hormone. The thyroid stimulating hormone comes from your brain. It goes to your thyroid over here in the neck and tells your thyroid to produce a couple of hormones. One is T3, the other one is T4. They don't check that. So if your thyroid stimulating hormone is normal on the lab work, you're normal, everything's good. But I'm tired, doc. I have constipation, doc. No, your numbers are normal. There's nothing that we can do about that. But if you're really looking at the hormones more in depth, you want to make sure we're looking at your free T3 and we're looking at your free T4. We're also looking at the antibodies that you mentioned earlier. We're also looking at the TSH as well, because that's going to give us the full picture. Because you may be in that normal number for the free T3, but you're not in that optimal number for that free T3. Okay, so I think that's very important to think about. And this thyroid hormone is critical for tissue repair, muscle maintenance, hair, skin health, and overall cellular turnover. So it makes your cells turn over faster. Again, it's really good for the skin, right? I tell my female patients that all the time. It'll accelerate that cell turnover. So low thyroid symptoms, again, fatigue and low energy, dry, coarse hair, skin, and hair thinning. So if I have a female patient coming in with complaints of hair thinning, it may be the thyroid that's doing that. Weight gain or difficulty losing weight because your metabolism is just so slow. And then cold intolerance. We have Jess here. So I was just in her office earlier. I was like, oh my gosh, Jess, like this is burning up here. I was like, we've got to check your thyroid, girl. We've got to check your thyroid. And she's the only one that's still cold and I'm sweating over here, right? So I told her, I was like, my thyroid is optimized, believe it or not. So we need to check her thyroid for sure. All right, so why are men scared? Why are men scared to do TRT? Do you think they're scared because they don't want to become Hulk Hogan? Or, what are they afraid of? Like, it's easy to do. So there was a study done in 1941. I think there was maybe like 3 patients in that study. But the results of the study based off of one patient, said that males who did testosterone got prostate cancer. And believe it or not, I keep saying that word a lot today, we still believe that. Providers still believe that. I have many patients that come back and tell me, hey, my primary care provider or my physician or my GP said that I should get off testosterone because you're going to get prostate cancer. Get off right now. They're trying to kill you. No. Modern data shows that TRT does not increase prostate cancer risk. Large trials like Traverse trial demonstrates no increase in prostate cancer incidence in men receiving TRT. It is very, very safe. TRT supports metabolic and cardiovascular health when appropriately monitored. Benefits include improved composition, body composition, insulin sensitivity, and bone density, and anemia correction. So we live in Colorado. Because of the higher elevation here, we naturally produce more red blood cells. Usually our hemoglobin hematocrit is going to be elevated a little bit than people who live on sea level. And I have a lot of patients who may be anemic. It could be male, it could be female. What testosterone does is that it makes your body make more red blood cells. So it could actually help patients who are anemic. Why are women scared? Why are practitioners that treat females, why are they scared to do hormones? It was because of this particular study, the Women's Health Initiative study. This was a landmark trial that overstated hormone replacement therapy risk for females. It really scared an entire generation of women into quitting their HRT. And in 2017, the original publishers of the WHI trial shared an article that stated that study was actually flawed, that it was actually misleading. So in this particular study, they didn't use bioidentical hormones. They used synthetic hormones like the progestins and the conjugated equine estrogens. The conjugated equine estrogens actually come from the urine of pregnant mares, horses. Okay, so these were synthetic hormones, whereas today we're actually talking about optimizing your hormones from bioidentical hormones. But everybody thinks they're all the same. No, they're not all the same. So the risk of blood clots, the risk of breast cancer, the risk of strokes was associated with these synthetic hormones, not with bioidentical hormones. So that's where some of the misconceptions come from. So what are your options for HRT? Now that you know some of the basic hormones that we really need to optimize, people can do injections. The more frequently you do hormones, the better it is because you get less fluctuations with that, less peaks and valleys. People can do creams. You can do pellets. There's patches also available. There's gels available. There's pills available. So there's all sorts of methods. And what I like is what's going to work best for the patient. So for example, say that you are a frequent traveler. Maybe you're a pilot. So you're out of town all the time. Well, maybe the injections are not going to work best for you. You travel, you got to take your vials with you. You got to take your needles with you. You got to take your syringes with you, right? That's probably not going to work the best method for you. So in that case, a pellet is probably great. Right? We can put it right underneath your skin here. For guys, it's usually above the belt, and for females, it's usually below the belt. And you're good to go for 3 to 4 months, or even 6 months for some patients. Or maybe you don't want anything under your skin. You're like, I don't want anybody cutting on me, making a little hole and putting something inside of me. So maybe a cream will work best for you. For guys, the creams are usually applied to their scrotum. For females, the creams are usually applied to their labia or even inside the vagina, depending on what kinds of symptoms that they're having. Injections can be sub-Q, meaning with a smaller needle, or injections can also be with a longer needle going in the muscle as well. So we can do it in the arm, we can do it here back in the butt area, or you can also do it right in front of the thigh area too. So there's all sorts of options. Really the best thing is what's going to best work for you, right? What's going to work best for your lifestyle? What's going to give you the best symptom control too? So if you're ready to feel your best, the best thing to do is to schedule a consult. And the other thing is that you have to get your blood work done, right? You have to know where your baseline levels are, where are your hormonal levels, and also you have to know what kind of symptoms that you're experiencing, so that when you do go on to hormone replacement therapy, when you come back, we can redo that symptom list and see what improvements that you actually gained from that. That's all I have as far as my presentation goes, but now I have questions for you guys.
We have a question from Vlad.
Oh, awesome.
So one of our viewers asked, if my husband isn't interested in medical testosterone replacement, what are some natural alternatives?
So there are some supplements that you can do for testosterone, to boost testosterone, but I would not recommend using oral testosterone boosters because they can be very harmful for the liver, especially for male patients. So why not just go straight to what the problem is, right? If your body is not making enough testosterone, I would say the best and the safest thing to do, rather than just taking a supplement over the counter, would be to just do the testosterone, right? Because that's what's going to give you the best results. But we do have some supplements that we have here at Levi from Avexius, like HRT Complete, which is a safe supplement that could help to boost your testosterone levels. You want to make sure your vitamin D levels are also optimal, because that is actually a pro-hormone. It can help to kind of boost up some of the other hormones in the body too. So those would be some of the basic things that you want to start with. But I'd say just go straight to the source. Just take testosterone. Unless, again, if a fertility is concerned, then we have to look at some alternatives too, because testosterone in males will lower their sperm count. So we have to really look at that, especially if they're planning on having babies soon. But that shouldn't hold you back, because there's some things that we can definitely do to help with that. Any other questions?
Are hormones safe to take while you're taking birth control?
What depends on what type of birth control. Yeah. If, say, for example, a female comes in on a oral birth control pills and their testosterone levels are really low, yes, it's okay to go ahead and take testosterone, right? Because we want to make sure that we boost that up. A lot of times for my female patients, I would recommend doing a Mirena IUD rather than doing something oral. But you also have to look at, how old they are. Are they in their younger years, or are they in their older years now, getting into their 30s and 40s, the perimenopausal period? Does it make sense to be an oral birth control pill, or do we need to just go ahead and get a Mirena IUD and optimize other hormones? So, what other questions?
Does insurance cover it if your primary doctor doesn't believe in it?
So insurance usually for females will not cover testosterone for sure. Yeah. So it is usually, when you're doing optimizing all the different hormones, it's going to be out of pocket for most people. Some providers who do feel comfortable going through insurance, estrogen and progesterone can be covered through insurance, but testosterone, 99% of the time, not for females. Yeah. We're just getting to a place where it might be covered for males, but insurance is pretty, you know how it is. When you need insurance, nothing is covered. That's what you find out, right? And then you wonder, what are we paying for every month? Yeah. What other questions?
Manpreet, can you explain the different modalities of like cream versus injectables and tablets?
As far as
Why one might be utilized in lieu of the other specific person's activities?
Yeah, absolutely. So the pellets, as I was mentioning earlier, I would definitely utilize pellets for patients who are frequent travelers. Maybe they can't get into the office soon enough to, do whatever procedures we need to do, or do their injections if they can't do the injections themselves. Or maybe they're very forgetful. If I have a patient that's like, I am not going to remember to put that cream on my balls every morning or every night before I go to bed, that's not the way to go, right? We call it ball butter, right? Putting that cream on your balls when you wake up. No, I can't do it. I'm not going to remember. Like, do you remember to brush your teeth? Like, yeah. Well, it's kind of the same thing. You just take a little cream, put it on your balls. No, I can't do it. Well, that person, once a week injection or twice a week injection might be great for them, right? Especially if they don't want anything as underneath their skin, or we're putting it in with a procedure. Or they're like, you know what? I want to just like put it in and forget about it and not even think about it anymore for another like 3-6 months. The pellet's probably the best thing for them. Yeah, pellet's probably best.
So then if someone is deficient in multiple hormones, where do you start?
Number one, start with the lab work.
Right.
Right.
Where would you start with treatment, I guess?
Mhm.
How would you go about that?
Yeah. So if it's a male patient, we're going to start with testosterone for sure. But there's a lot of other hormones that we look for. The vitamin D, as I mentioned. Every person that I've checked so far, the labs, the vitamin D levels have been in the 20s. Okay. In the 20s. Even in Colorado. We think we live in sunny Colorado. It's sunny here 300 whatever days, right? But no, even in Colorado, our vitamin Ds are actually very low. So vitamin D in a male, also testosterone in a male. We don't do estrogen routinely in a male. We don't do progesterone in a male. The other hormone that's really vital is DHEA in both females and males. In a female patient, I would start with, first of all, checking those hormones, right? In a perimenopausal patient, they do not need estrogen. Perimenopausal patients do not need estrogen. There's a lot of stuff on social media nowadays where they're starting perimenopausal females who have not stopped their periods yet for 12 months, putting them on estradiol. The reason being is because when you are in that perimenopausal period, I will check a female patient's labs and her estradiol, her estrogen, will be at 400. I have her come back the next week, her estradiol or estrogen will be 40. It's a yo-yo effect, up and down, up and down. Why do you think we're so moody in that perimenopausal years, right? Why do you think my kids would call me crazy during that time period? We don't know what mom is going to walk in the door. So in that period, they will need progesterone for sure, because that's going to calm me down, right? That's going to reduce my anxiety. That's going to help me with my sleep at nighttime as well. And then that testosterone and that DHEA for the female patient too. So that would be a start. And again, that thyroid is going to be icing on the cake. Unless I see that thyroid is really, really low, we may just start there too, depending on the comfort level of the patient. I never dictate, hey, this is what you need to do. I always tell my patients, here's what's going on. You tell me where you want to start. You tell me where you feel comfortable. Some of the patients will say, hey, I just want to do one thing at a time. Fine. Let's just do one thing at a time. Some patients are like, nope, give me everything. Give me everything you got. All right, that's fine too. It's whatever works for you, I think is where I would start.
We have another question on live. She wants to know, will hormone replacement increase fertility in perimenopause?
Do that on your mic too.
Oh, I'm sorry. What?
Will you repeat the question?
Okay, let's repeat the
Or you
question.
can answer a full question too. So will hormone replacement increase fertility in perimenopause?
Will hormone replacement therapy increase fertility in perimenopause? So I think what this person might be referring to is also PCOS. That verbiage has changed actually as of, I think, a week ago. What is it called now?
It's
PMOS. It's very new. I haven't, totally gotten it into my brain yet, into my memory. I still are saying PCOS. Could be referring to PCOS, which can happen in those perimenopausal years and even before that, right? Because you can have it in your teenage years, PCOS. So if you correct those hormones during that time period, it can affect your fertility in a positive way. It definitely can. Mm-hmm. Any other questions?
What if you've been on HRT for years and you want to recheck your levels again? Would you need to completely get off any hormones, or could you actually get your blood work done if you're taking estrogen and progesterone?
Yeah. So it's important to check your blood work after you start your HRT on the HRT, because we want to see where your levels are, right? So if you start to take testosterone, I want to know how high are you actually going on that testosterone? Are you actually getting benefit or not? People will always ask me, well, what's my number? What's the normal? Where do I need to go to? I say, well, we need to go to the number that makes you feel better. That doesn't mean I'm going to have you running at 1200 for a female, but still we need to make sure that we're checking your lab work so that we can make sure you got some safe levels in there, right? Where you're not having a lot of side effects associated with that. So that's a great question. It is important for us to check your lab work on that estradiol, because the estradiol levels in a post-menopausal female to be good for your cardiac health and your bone health should be between 70 to 100. So I want to make sure that I'm getting you there, that I'm changing your dosage with that. Same thing with thyroid. I want to know after you take your thyroid medication in the morning and you check your labs about 5 to 6 hours after you take it, how high are actually going? Is your free T3 now in that range that we want it to be? Is it in the range where you actually feel better, right? So it's really important to check those numbers while you're on the hormone replacement therapy versus off of it. Yeah, great question.
I have a question for thyroid, for the T3 and T4, do you normally compound those together?
Do you normally what? I'm sorry?
Compound it together in one pill?
Great question. So where the commercially available thyroid medication is Synthroid. And most of you probably have heard of that. That is just T4, just T4. Our thyroid makes T3, T4, and calcitonin. So some people who take Synthroid will not convert over that T4 into T3, which is the most active hormone. So even if you're taking Synthroid, you may not feel better. So I routinely prescribe natural desiccated thyroid, or NP thyroid. That's T3 and T4. So now you've got both of them. You don't need that conversion over to T3 from just taking Synthroid. It works great for some people, but it doesn't work great for other people. So you have to really look at that. Great question. Yeah.
Compounding made a difference to me because I was taking the generic thyroid and it built up toxicity in my body. And I had to move to compound. It makes a big difference.
Yeah, it makes a huge difference from a compounded pharmacy, micronized progesterone, compounded thyroid, because it's T3 and T4 together, really, really helps the energy levels of the female. Sometimes just that one hormone can make an amazing difference for a female. I do prescribe it to males too, but I find that females benefit more from the thyroid hormone than males do. So that's routinely something that I see with them. Great question. They're asking a lot of great questions. We were supposed to do some giveaways and raffles, right? For these questions. I thought I was going to have to dig them out of them. But we got some great prizes for you guys. I have actually questions for you all. So Janelle, let me see that sheet over there. Yes, ma'am.
Are there any instances or usual people who have adverse reactions to any of the?
Yes, there's side effects to everything, right? Side effects to everything. So progesterone, for example, great for sleep. But sometimes females will come back and say, I'm too sleepy in the morning time when I wake up. I'm just way too groggy. Some people just can't tolerate that. So that could be a side effect. With testosterone, one of the things I already talked about, especially in males, it will decrease their sperm count. So the first question I usually ask them, what is your plan for fertility? Most people will say, hey, you know what, maybe I've had a vasectomy, or I'm done, we're not having more kids, I really don't need that. It can also accelerate male pattern baldness in males. Sometimes it can cause some hair thinning in females as well. Usually it's more related to other issues, and they've got some dead hair that just needs to be fallen off, and it just accelerates. And then female patients will freak out about that. A lot of times if we correct their gut health, it really helps, or in combination with thyroid, that can really help. The other common side effect that's kind of across females and males with testosterone side effect is acne. it can happen. Like the hormonal acne sometimes pops up. For guys, it's more like on the back or the chest area. For females, oh, sorry, I didn't mean to like bump that. For females, it could be like on the face area too, depending on like if you had acne as a teenager in certain areas, it may exacerbate it in those areas too. Yeah. But it is not going to change your mood for the worse. That's one really common question I get. Is it going to give me void rage? You know, I'm going to go crazy. No, it's not going to do that. It's not going to do that. Again, remember, if you were jerked before testosterone, you're going to be jerked after testosterone, but it's not going to make you that way at all. Great questions. Really great questions. Okay. We're ready to do some. Okay. I have questions for you guys. So a little competition here. All right.
Come spin the wheel for a prize.
Yeah. So, true or false? Hormones are chemical messengers that give instructions to cells and organs to keep us healthy. Maybe we do a hand raise, right? That was an easy one. All right. We need a buzzer. Who's going to spin? All right. Let's pop up and spin for a prize. Go for it. There you go. I think I heard your voice the loudest.
I said false, I think.
No incorrect or correct answers. You get to spin the wheel. All right. Blank. You still get something for you. You still get something from your wife. Yeah, you choose something for you. That's a great product, actually. Really, really, yeah, great product. All right. What does the term andropause refer to? What does andropause? All right. You got it. You got to spin the wheel. That's right. It's warm in here, right? Yeah, it is warm in here. Uh-oh, andropause. Fancy. Yeah, that's right. Absolutely. So what is the average age that menopause begins? What?
50.
Okay. Okay.
53, 54.
Okay. 53, 54, closer. You got it. Yep. Varies, you're right. It does vary. Okay. So what hormone is responsible for protecting against bone loss, heart disease, and memory disorders? Ah, you got it. I heard you first. Estrogen. Wow. Okay, let's see. Name one symptom of low testosterone in men. Low libido. Yeah, she looked at him when she said that. She said, low libido. I don't know how he feels about that right now. Yep, that's right. You get to spin. Yeah. That's funny. He was like, thank you for putting that out there. Okay. What is progesterone's role in sleep? What does it do with sleep? We know it makes us sleep better. Anything?
What was the question?
What is progesterone's role in sleep?
Helps you sleep through the night.
Yeah. Really establishes that normal pattern, right? Yeah. Fall asleep, stay asleep, which a lot of people have. You guys are just on a roll.
We do not need another
Somebody else spin. Get up and spin if you haven't spun yet. Get a nice little perk there. Who wants to
We're
spin?
waiting for the next question.
Go spin. Go spin. Yeah.
More questions.
Get a little prize.
This is-
All right. Okay. What is one symptom women might experience during perimenopause? Yeah, all of that. You're right. All of you guys are correct. Mood swings, feeling crazy. Yeah, you're absolutely correct. Tracy, they all get to spin. Yeah, who haven't done it yet? What now? That's right. Come spin the wheel. Come spin the wheel. She has all of them. That's right.
Zero.
Okay, my last question here for you guys. What mineral loss is common in women after menopause and can lead to osteoporosis? Oh, yeah. Who said calcium? Who said calcium? Yeah, calcium. You're right. You're right. I didn't talk about calcium that much, but you're right. Yeah. Bone density, calcium. Yeah. All right. Sorry, I can't do those. Plate is good. Okay. Do we want to do the labs? Do you want to do more? Okay. Let's see. Where's the... Sarah, do we want to do the lab draw? Okay,
I told
great.
everybody to turn them into the front. So if you guys have the sheets up here, if you want to pull from those.
Perfect. I just have 4, so did anyone else fill them out by chance?
Did did everybody fill out a sheet for symptom checklist? No? Do you want to fill one out? Okay, don't worry.
Perfect. Well, I'll let Ms. Chanel from there, so she's not.
Yeah. So,
Yeah.
Oh, wait, yours.
you're like, yeah, my goodness. No, we're good. So, Alan, you will get a free lab draw and I will review those labs with you.
Am I supposed to be scared? Isn't that what you said?
No, you shouldn't be scared. Not scary. See, aren't you glad that you stayed, right?
Absolutely.
Yeah, absolutely. What about what else we got there, Tracy?
Next year, Alyssa, everyone who's attending the event today is going to get $200 off of their second month if you do sign up for our membership. So it's a great opportunity. And then if you sign up for a consult today with Manpreet, then you'll be entered in to get some really fabulous prizes like a full-size Ultra Advanced, full-size plated exosomes, or our 40-ounce tumbler. So great perks if you'd like to sign up for a consult today.
What's the membership?
Tracy, I'll let you
Sorry,
kind
what
of
was
explain. She said, what is the membership?
The membership, so it's gonna be dependent. You're gonna come in and see. Oh yeah.
Oh,
Well, Manpreet, why don't you explain what the consultation looks like?
I guess I can talk into it now. As far as what the membership really includes, at least for that first year, is first of all, is going to be like a quick phone call with one of our, tell me, Jess, coordinators, our coordinators, and she will just do a quick screening to make sure you're like a good fit for this particular program, and then set you up with a initial consultation with me. At that particular consultation, we talk about your symptoms. You fill out the same symptom checklist. We look at your nutrition. We look at your exercise. And then we have, MyFit Foods here too that we would refer you to. We've got, exercise people here as well that we will refer you to, pelvic floor therapy people here that we might refer you to, depending on what symptoms that you might be experiencing. And then from that particular appointment, if you're like, yeah, I want to do this, I want to move forward, I kind of lay out the various options for you, the things that we went over today, and other additional modalities as well. And then if you're like, yeah, I want to move forward, we go ahead and draw your labs that day. And then we send your lab work. It comes back usually within a week or so. And then we would schedule your appointment after your lab work comes back. And that's your findings appointment. Okay, you came in for the first consultation and you told me these symptoms, X, Y, and Z. And now let's see if we can correlate some of those symptoms to some of the things that we see on your lab work too. Maybe it's your thyroid, maybe it's your testosterone, maybe it's your estradiol, maybe it's your progesterone, maybe it's some of the vitamins and minerals that you're actually deficient in. And then we come up with a plan that's tailored for you. Consisting of supplements, consisting of nutritional therapy, and also consisting of exercise regimen too. And we do have the supplements in-house through Avexia Solutions and there may be other supplements that I need to order for you. We also have an option for you to do a specialty testing. So that could be a micronutrient testing. It could be the Gallery cancer screening test that you might be interested in doing. So that will be usually around that 6-month mark to see, whether or not there's other things that we need to add on to that particular regimen. I have you back for lab work depending on what type of therapy that you decide to choose, anywhere from 6 weeks to 3 months or 4 months. So you'll be seeing me pretty frequently. And I also check in with you with a phone call too after you start on therapy. Hey, did you get everything? Do you have any questions about anything? And how are things going? Are you having any side effects? How do we mitigate all of that? So that's kind of like the full picture of what the year might look like. And after the year, maybe you're stable, or maybe in 6 months later, you're like, I want to switch to something else. I tried the cream, I don't like it. Okay, well, let's switch to something else and see if that might work better for you. So you're not really stuck with anything. You're not married to it forever. You can change your mind and divorce HRT if you want to. It's easy. Yeah, great question.
Can I piggyback something on
Yes,
that?
please.
Manpreet had mentioned earlier, regarding especially gynecomastia being a common issue. Accessibility to, our other providers here as well, because obviously she's handling the hormone replacement therapy, but there are other services that kind of go hand in hand with that as far as vaginal rejuvenation. That's something that we do here. Or other things such as we have a full hair restoration clinic. So some of those concerns about hair loss, hair thinning, that's a common denominator with that. We have great accessibility to some of those other modalities that go hand in hand with hormone replacement. So the accessibility is definitely great. And by already kind of knowing and being established with Manpreet, so that if any of these things are already occurring or do occur, we're in a better position to kind of holistically treat you all the way around instead of saying, oh, you need to go here for this or you need to go there for that. There's other features and things, modalities that we can offer as part of that. So
yeah, that's really great segue to what I wanted to also say is with weight loss. I have quite a few patients that are on GLP-1s with weight loss. Inevitably, when you are on weight loss, you're going to have some skin laxity, right? On the arms, maybe the belly area, thighs. So that's a really great transition into our surgical services too. Or vice versa. If somebody's looking to get surgery, they may not be eligible because maybe they just have a little bit too much of a BMI, a little higher end BMI. That's where we can look at weight loss first, look at nutrition first with MyFit Foods, look at exercise first, going to yoga and doing other things, pelvic floor therapy as well, and then transitioning over into the surgical services. So again, I say this over and over, that's one thing really attracted me to become a provider here at LaVie was that transition from one thing to the other, because most of the time we have to refer a patient out. Yes, we still have to do that with certain things, but there's a lot of things that we can do here in house. So, but great point there, Jess. Anything else? More prizes?
I know we got more, has more questions. Bob.
Ask more questions. Okay, let's see. All right, true or false? This is an easy one. Oh, maybe I asked that one already. Okay, testosterone is important for both men and women. True, Liz. I heard you say it first. I think get up and swim that wheel. That's one bands. A lot of people. What hormone increases metabolism and promotes weight loss? There could be different answers. Did you just say progesterone? Yeah. Did you just give away the answer?
Then you get to choose, just like us.
How many functions does estrogen have in the body? The number I put up there. It could be higher, in the hundreds, higher. 400. Come on, you get to spin the wheel too. Yes, you get to spin the wheel. Maybe he'll get the shaving cream. I don't know. Alto dance is good too. You get the shaving cream. That's right. It's a good product. All right. Anything else?
No.
Any other questions?
If you guys want to
Yeah.
ask more questions, you can ask directly with Manpreet. We can get you scheduled for a consultation tonight, get you set up and enter into our raffle prizes, and then also chat with our vendors that we have here.
Yeah, absolutely. With physical therapy, especially pelvic floor issues with females, it can be huge. So I think that could be very helpful.
I'm Ashley's other half.
Gotcha. I was like, wait, it's somebody, Ashley's other half? Tell us what services usually you guys do for
I'm
females.
Sarah Powder. I'm a pelvic floor physical therapist in Cherry Creek. Thanks. Hi, everyone. I'm Sarah Powner. I'm a pelvic floor physical therapist in Cherry Creek. I'm also an orthopedic therapist as well. I did a residency in orthopedics and just specialize in pelvic health as well. One thing that I will say for my patients that are going through menopause, postmenopause, even with musculoskeletal injuries that are not pelvic floor concerns or related at all, I talk to them about HRT. Because your recovery and ability to recover, if you have no estrogen, it's very, very difficult. It's very difficult to build lean skeletal muscle mass, which is a big leading cause of osteoporosis, is that we just can't build more lean muscle mass. So it's something that I talk to almost all of my patients about, and I'm excited to have a provider that I can point people in the right direction towards. I just moved here from Los Angeles. So yeah, but I would love to talk to anyone about their injuries, whether it's pelvic or non-pelvic concerned. I treat males and females as well. A lot of prostate issues with males too. So yeah.
Thank you.
Thanks.
Anything else? Any other questions for our vendors, our MyFit Foods? We've got hairstylist, gallery testing. Anything else?
Okay.
All the things.
I know, Liz, you're there. Yeah, it's great. Great. The food is really good. Yeah. You should be one of their ambassadors.
It's good. It's good.
I do want to mention that real quick. So as a member with LaVie, if you're on one of our membership programs, you do get access to the MyFit Foods at a significant discount of 30% off. And so it's a great patient offer. So they have fantastic foods. We all love them. And they'll do some really great body composition analysis with you.